Hi, my name's Grace and I was diagnosed with acute myeloid leukemia, which is cancer of the bone marrow. My main and most obvious symptom was recurrent infection, which for me manifested as a tonsillitis infection that was really, really bad and would not go away. It was packet of antibiotics that were doing nothing, and it was getting worse and worse and worse. I also experienced a lot of gum inflammation, so my gums were literally growing over the backs of my teeth, which was obviously really painful. I experienced a lot of bone pain, so I was getting pain all in my ribs and in my toes, weirdly, as well. I'd experienced rashes, like if I just itched, like a normal scratch, like anyone would. I'd get like bleeding under the skin, which is called a petechiae rash. So it's due to a lack of platelets, which happens if you have leukemia. Your platelet count generally drops. So yeah, I was getting petechiae rashes. I felt very tired. I literally could not focus on anything, as well as just a general feeling of being unwell. So those were the main symptoms for me.
Hi, my name's Emily. I'm 21 years old and I was diagnosed with acute myeloid leukemia at the age of 20. The symptoms that I first experienced were unexplainable bruising all over my arms and my legs. There was around 50 plus of them. My skin went really pale and I looked really washed out all the time. And I also experienced a lot of fatigue. This was when I'd literally not done anything at all through the day. And those were really the only symptoms that I had.
Hi, my name's Charlie and I was diagnosed with stage 2 Hodgkin's lymphoma, and the symptoms I experienced was breathlessness, fatigue, unexplained weight loss and persistent itching, and it started off as a lump on my chest, which I then went to the doctor to go see what it was. But there are other symptoms such as night sweats and high temperature, and the symptoms I experienced were just normal everyday things which I put off for other things that I was experienced, but later found out that it was due to Hodgkin's lymphoma.
Hi, I'm Molly and I was diagnosed at 24 years old with primary mediastinal stage 4 diffuse large B-cell non-Hodgkin's lymphoma, very long name. My first symptoms started off as painful breathing and chest discomfort, which later progressed to trouble swallowing stuff, and it got really bad. Also shortness of breath, so when doing exercise or even just like walking upstairs, I get really short of breath, I couldn't catch it. Extreme fatigue, so I'd be really tired, I'd have to have a nap during the day even though I'd done nothing really. And then also I got itchy skin all over for no reason again, it was really weird, and a rash finally later on before I collapsed and were then diagnosed with a melon-sized tumour engulfing my heart and lungs, which was why I couldn't breathe. So yeah, a lot of the symptoms could have been kind of brushed off as everyday things, so it's really important that you don't accept any symptom as the new normal for you.
Hi, my name is Alex and I have stage 3 pancreatic cancer. One of the first symptoms I experienced was back pain that got progressively worse. Then I noticed changes in my stool, shortly followed by changes in my urine. Eventually, I was jaundiced, which means that my skin and my eyes started turning yellow due to high levels of bilirubin. And that's when they finally did blood tests and other tests on me, which got me my diagnosis.
Hi, my name's Ellie and 2 years ago I was diagnosed with osteosarcoma, which is a rare form of cancer that grows in the bone. My symptoms were mild pain in my knee with a lump that started growing, and then whilst the lump was growing I then was experiencing more and more pain throughout the night, that's what sort of like the telltale sign is, having pain throughout the night when you're not putting any like pressure on your knee or on your leg at all. I then had been to the doctors a couple of times over a period of 6 months and finally got an MRI scan, and from the MRI scan that's where I got my diagnosis.